Gas and bloating are two of the most common symptoms that present in clinical practice. Gas and bloating can be pathognomonic or defining of SIBO, small intestinal bacterial overgrowth. Do you suffer from gas and bloating after eating? Do you suffer from gas and bloating all day long? If you do, you may suffer from SIBO. And as you're about to find out, SIBO can have many causes. Now, I see multiple patients in my functional medicine practice that suffer from SIBO, and many of them have seen a GI doctor and been diagnosed with irritable bowel syndrome or the like. And that may be true, but as you're about to find out with SIBO, it can be caused by something outside of the GI tract. And if the cause of your SIBO is outside of the GI tract, then you may not receive benefit from your gastroenterologist. Let's talk about SIBO and how it may be impacting or leading to your health challenges. Now, as mentioned, SIBO stands for small intestinal bacterial overgrowth. So naturally, the gastrointestinal tract is going to be a prime player in the presentation of SIBO. So what we're going to do is we're going to draw out the physiology to help learn and understand what's going on. So this is our stomach. Now in the stomach are a layer of cells called the parietal cells. And the parietal cells line your stomach and they produce what's called hydrochloric acid, or HCl. And HCl, hydrochloric acid, is the prime digester of protein that you consume. So when you eat protein, it enters the stomach, and in a healthy stomach, the parietal cells create HCl, and that HCl starts breaking down the protein. Now, HCl breaks down the protein, and it also functions to sterilize the small intestine. So HCl digests protein and sterilizes the small intestine. So in a healthy stomach with healthy parietal cells, we're creating HCl, we're digesting protein well, and we're sterilizing the small intestine well. So you likely won't have SIBO from that cause anyway. Now, if the parietal cells become damaged, then we're not producing proper amounts of HCl, we're not digesting our protein well, and we're not sterilizing the small intestine, which can create an environment that will help facilitate a SIBO infection. So what can damage parietal cells? There are multiple things. Autoimmunity is one thing. You can have autoimmunity against your parietal cells. An H. pylori infection. H. pylori can infect the stomach and damage your parietal cells and your ability to create hydrochloric acid. And so can proton pump inhibitor drugs. So proton pump inhibitor, if you have GERD, reflux, those sort of symptoms, you're probably on a proton pump inhibitor. If you're on a proton pump inhibitor, research has shown that 53% of people on PPI drugs have SIBO. So if you're on a proton pump inhibitor and you have constant gas and bloating, you likely have SIBO, and it may be being caused by your medication. Now, from the stomach, the food that you consume enters the small intestine. And then the small intestine empties into the large intestine. So this is the small intestine, and there's three parts: the duodenum, the jejunum, and the ileum. And right here, where the small intestine dumps into the large intestine, is a key, very important valve called the ileocecal valve. And that's a one-way valve that allows things out of the small intestine into the large intestine. So this is our small intestine, and this is our large intestine. So as I said earlier, in a healthy stomach, HCl digests protein and helps sterilize the duodenum, or the small intestine. A healthy small intestine will have relatively low amounts of bacteria, 10 to the third bacteria per milliliter, as compared to the large intestine has 10 to the 8th. So exponentially more. Okay? Now, In a healthy GI tract, the food travels down the small intestine, enters into the large intestine, and in the large intestine you have lots of bacteria, as we just stated. And those bacteria do many things for us. They help protect us by forming our microbiome. They create vitamins for us, and they'll also eat our fibers and starches and ferment them to produce short-chain fatty acids and other beneficial chemicals and nutrients that we use to mount an immune response and do all of the functions our body needs to do to keep us healthy. So the bacteria in a healthy large intestine create gases. One would be methane, one would be hydrogen, one would be CO2, to name a few. Okay? And when in a normal healthy large intestine, these gases are going to enter the blood, and from the blood they're going to travel to the lungs to be exhaled out many times or excreted. Now, in an unhealthy gut, if you have gas and bloating that leads to constipation, then many times that is a methane overproduction, or you would be said to have an overgrowth of methane producing microbes. Archaea is an example of that. If you have gas, bloating, and diarrhea, then you are said to have microbes that are producing too much hydrogen gas. Okay, so the type of or quality of your stools can tell us a lot about what kind of bacterial overgrowth you have. So this is a healthy situation. In an unhealthy situation, what can happen is the gas can build up in here in the large intestine and go the wrong way through that one-way valve. And what happens there is the valve will blow open and bacteria will what's called translocate, or transport from where they should be to where they shouldn't be. And now they're causing an infection in an area that should normally be relatively sterile. So when you get abnormal amounts of bacteria in the small intestine in SIBO, they can rise as high as 10 to the 5th milliliter, so an exponential increase. And so this will lead to things like malabsorption of food, poor digestion, changes in gut motility or the ability to move stuff through. So constipation would be one, diarrhea would be another issue with that. So this is the GI mechanism of SIBO. Now, this isn't the entire GI tract, correct? We also have up here the pancreas, and the pancreas secretes digestive enzymes, pancreatic enzymes, into the duodenum to help digest our fats, proteins, and carbs. And we also have the thyroid, which plays a role. And the thyroid plays multiple roles. The thyroid will trigger the stomach to produce hydrochloric acid. The thyroid will trigger the pancreas to produce the enzymes. And the thyroid will trigger the GI tract and cause gut motility, or movement of things through the tract. So as you can see, now we've added another player to the SIBO picture. As I mentioned earlier, you could have SIBO and go to your gastroenterologist and they're just going to look at the GI tract. They may biopsy your stomach or biopsy your small intestine to see what's going on with the cells. Or they may, before that, start you with proton pump inhibiting drugs. Or give you things like Linzess for constipation. But if the cause is not in the GI tract, those things aren't going to help. And even if the cause is in the GI tract, drugs aren't curing a condition, drugs are only covering up symptoms. So you want to look farther. Okay, so if we have a thyroid problem, then we may have an HCl problem, we may have a lack of enzymes, we may lose motility. So we need to evaluate the thyroid in a SIBO patient. Now, another issue is that all cells need certain things to function in the body. It doesn't matter if it's a hair cell, a liver cell, a heart cell, a brain, a neuron. It doesn't matter what type of cell we're talking about. All cells need oxygen, and all cells need glucose. So they need air and they need sugar, because both oxygen and sugar enter the cells and are turned into what's called ATP, and that is the cellular energy currency that our body uses to get things done. So if a person is, say, anemic, they're not carrying oxygen well, they're hypoxic. If a person has blood sugar issues, then they're not delivering sugar to the cells and creating energy well. So you could have SIBO as a result of anemia or blood sugar issues, because all cells need these guys, including your brain. Your brain and brain stem. So if your brain isn't receiving oxygen and glucose like it should, it's not going to function well. Well, tell me, what does your brain control? Everything, that's right. So if we are anemic or we have blood sugar issues, then our brain's going to suffer, and therefore the entire system's going to suffer. So you could have SIBO due to multiple brain issues. It could be due to an anemia and or a blood sugar issue causing the brain frequency of firing to decrease. You could have brainstem issues that are affecting the vagal nucleus, and the vagus is the brainstem nucleus that controls the parasympathetic function all the way down to the splenic flexure. So the vagus is going to also lead to HCl production. The vagus is going to work on enzyme release in the pancreas. The vagus is going to control motility in the gut. It's going to support motility, secretion of things like our enzymes and other digestive juices, and absorption of nutrients. And then also the vagus controls the ileocecal valve. So if we have a brain issue or poorly firing brainstem, then that could be a cause of the ileocecal valve, which it should be a one-way valve, becoming faulty and allowing these bacteria back into the small intestine. So you could have SIBO because of a brainstem issue, a functional neurological issue. So I hope you can see today that SIBO is a much larger problem than just your gut. If it's coming from your brain, well, what would cause a brain issue that could cause SIBO? Well, what damages the brain? Many things damage the brain. So say you had a mild traumatic brain injury, a concussion, whiplash, hit the steering wheel with your head. It doesn't even have to be that bad. What if you bounce a soccer ball off your head 100 times a day? As we mentioned, blood sugar issues can cause brain damage or functional neurologic changes, so to function less than optimal. Anemias can cause issues. High cortisol, high stress can cause issues. Obviously surgery, if you've had brain surgery, that can cause issues. Autoimmunity to the brain can cause issues. So there are any number of issues that can cause the brain frequency of firing to decrease, which changes the brain-gut, gut-brain axis and communication and can lead to SIBO. So let me ask you this. What do you think would happen if you went to a neurologist with a complaint of gas and bloating? Your neurologist would probably say, I see here you're here with a chief complaint of gas and bloating. Why are you here? Okay? So we're so specialized now that a neurologist is only thinking brain, brainstem, and those hard lesions, tumor, hemorrhage, etc. So they're probably not going to say, okay, gas and bloating, what did I learn about the gut-brain axis in school? How can we tie this back into SIBO? Not going to happen in our mainstream medical model. So if you are someone with SIBO but it's coming from a brain issue, you're kind of out of luck unless you find a functional medicine, functional neurology practitioner that understands these things, can evaluate the entire system and find out where your hiccups are. Is there some iron insufficiency leading to your problem? Is there some hypochlorhydria or low stomach acid leading to your problem? Is there a thyroid issue? I think you get the picture. So if you are someone who has suffered for years with gas and bloating, IBS, irritable bowel syndrome, constipation, diarrhea, or back and forth between the two, constant indigestion, and maybe you've noticed some symptoms of less than optimal brain function and or less than optimal thyroid function, cold hands and feet, chronic fatigue, etc., then your SIBO may be coming from somewhere other than your GI tract. And you need to see a practitioner that can assess all of these things together, understand how they work together, and then create a solution for you to get back to a life at optimal. I'm Dr. John Bartemus, and that is what I am passionate about, and that is what I do on a daily basis. I look forward to working with you. Have a great day.